if you're 65 and older, you may already be enrolled in Medicare, or you may have opted to delay enrolling if you had group health coverage from your employer when you turn 65. The Medicare initial enrollment period starts 3 months before your 65th birthday and 3 months after the month you turn 65. So now if you've already enrolled in Medicare, I could give an entire presentation just devoted to nothing but the ins and outs of Medicare. But today we're going to go have just a simple, very quick review. All right. So Medicare's got a few different parts. It's got Part A, which that covers hospital costs. Part B covers medical services like doctor visits and outpatient care. If you've paid all those FICA taxes, that come out of your paycheck for at least 10 years, you won't pay anything for Medicare Part A, nothing. Medicare Part B has a premium currently of $144 a month in 2020. However, that will be higher if your income is over a certain threshold. While Medicare Part D is the next part we'll go over. That's prescription drug coverage. And while it's not required that you enroll in Part D when you're eligible for Medicare, this is an area where you should be careful, because if you don't choose to enroll in Medicare Part D when you're eligible and you don't have what the government calls credible drug coverage, say like COBRA or another insurance program, you could later be liable for late enrollment penalties. And so I never forget those that I've met that are paying some of those penalties. And the penalties based on a formula. And if you've been without coverage for a long time, that can add up to more than the cost of the Part D premium itself. And so in these cases, this is usually what happens. We find someone that's been healthy as a horse, wasn't taking any medications when they enrolled in Medicare, so they didn't think a Part D plan was needed. And then later, when that person found themselves prescribed some expensive prescription medication, as a lot of people are at some point in their life, now they need coverage. And that's when they're surprised with the penalty. We don't want to see anybody in that situation. And there's also several other options when including Medicare. Some people choose to supplement original Medicare Parts A and B with a supplement program, or some people call it a Medigap plan. And the insurance policy helps cover the costs that Medicare approves but doesn't pay. Like, Medicare supplements also, by the way, they do involve a premium in addition to that Part B premium, and drug coverage is not included. So people will generally have to pick up a Part D prescription drug plan as well. There's also something called Medicare Advantage plan, sometimes called Medicare Part C. Confused yet? And these are offered by private insurance companies, and they usually include all the benefits and services that are covered by Part A and Part B. Many also include the prescription drug coverage, and some add extra benefits, sometimes like dental, vision, or even gym memberships. And Medicare Advantage plans may have monthly premiums in addition to Part B. They may have a deductible, and they generally have copays and coinsurance, and they usually feature in-network and out-of-network providers, a lot like an HMO or a PPO plan. And so those ins and outs make it pretty important for you to consider all of your options for healthcare coverage, whether you're enrolled currently in Medicare or you're just going to be Medicare eligible soon. So I look at it as, if you do the Medicare Advantage, you could get it all packaged, like Part A, Part B, Part D, drug program all in one. But then it's really hard to move back out. And then Medicare Supplement is a little bit more nimble and flexible, but it's not one big package. It's more like piecemealing your exact plan together is kind of how I look at those two. If you need help, assessing any of your health insurance options for Medicare, we can look at your situation and give you some help. We can also connect you with professionals that provide different solutions that we may not. Also, we do Medicare here, and so if that's an area that you guys are looking at, we can absolutely help with that and the supplement programs and looking at the different drug programs. We do all of that. I just say, with everything that's going on in the world right now, it'd be way too easy just to sit at home. Right? Just say, all right, I'm just not going to do anything. Let's just wait or hope for things to happen. But as I've always said, hope is not a strategy. Hope is not a strategy at all. Now's the time to plant your heels and maybe like this guy with the boxing gloves, maybe fight back. I love that. I happen to be a martial artist. I got a black belt in Taekwondo. So anytime I see anybody with boxing gloves on, it just kind of makes me a little excited, right? So what you guys can do right now is time for you to define your next chapter, your next adventure. You get to define your worth, not somebody else. And no matter what your immediate future holds, whether that's a new career, whether that's part-time work, the opportunity to embrace retirement today, just know we're here. We're here for you. There's no greater satisfaction, I think, than helping people like you all figure this out. Figure how do I determine that next step? How do I move forward with confidence? Now is not the time to be worrying or wondering when you can be in control. Now is the time to know that you can be in control.